Paso Fire Department is rolling out 6 brand new mobile health units, SUVs designed to bring faster, more personalized care straight to your neighborhood. Thanks to the grant, the department's health division now has more tools on the road to help improve community health and resilience. Joining us now is Assistant Fire Chief Gustavo Tavares to talk about these vehicles and what they mean to El Paso. Good afternoon, Chief.
Thank you. Thank you for having me.
Of course, and thank you for coming here. And Chief, what kinds of services will these new mobile health units provide for the public, and why they can expect from the fire department?
So these new vehicles actually can provide a service that's really centered to the community, to the patient. The service they provide is, not an emergency situation, but more of a proactive approach towards, health and towards being able to go ahead and provide patients things that they need to be able to overcome some of the things that make them call 911.
Definitely sounds something really great for here, the borderline. And how do these units help reduce the strain on emergency rooms and first responders?
So these units are staffed by community paramedics. Those community paramedics have received additional training to deal with mental health patients, to be able to go ahead and address and identify the social determinants of health, so that they can go ahead and provide the resources that are needed for the individuals. When they do this, they're able to go ahead and mitigate some of the situations that would typically require them to go to the ER, or would typically require them to call 911 so they can be transported to the ER for their evaluation. So they're able to deter those type of calls by being proactive and going to the community, assessing the real needs of those individuals, and focusing on those individuals and bringing the holistic approach to be able to address their needs, where an ER room would not be able to do that. One example I have is, our team, our MIH team, actually responds with a critical crisis intervention team. When they do this, they bring the medical component to the scene. By doing so, they can make a determination whether this individual needs to go to an ER, or they can actually go directly to a mental health facility. When they do that, then it elevates the individual from going to the ER, taking up a bed, using up space there, when really they need to be transported to a mental health facility for their emergency or for their situation.
Okay, it definitely seems like our city is growing, and so is the care. And you mentioned these are all part of a mobile integrated health. Can you explain what that program is and why it matters to more than ever?
Yes, mobile integrated health is actually a concept that is tried across the nation. And this concept, we take a proactive approach to be able to go out and have a system where it's centered on the patient, centered on the needs of the patient. So it brings those resources to the patient through resource navigation, and brings that closer to the patient.
Thank you so much for your time, and we're looking forward to seeing those out on the roads. And we'll be right back after this short break. Stick with us.